Raw onions are one of the most common ingredients in salads, sandwiches, and appetizers. Many people consider them to be healthy and even essential. However, behind their strong smell and sharp taste lie risks that can affect your well-being, especially if you eat them frequently and in large amounts. Here are 10 concerning facts about what might be wrong with raw onions. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Raw onions can cause serious digestive problems, disrupt stomach function, and trigger gastritis. According to recent data from the National Institute of Diabetes and Digestive and Kidney Diseases, more than 60 million adult Americans suffer from chronic or occasional gastrointestinal disorders. Each year, the number of patients diagnosed with irritable bowel syndrome and chronic gastritis continues to grow, especially among women between the ages of 30 and 60. Against this concerning trend, certain everyday foods that were once considered completely safe are now being closely examined. One of these foods is raw onion. At first glance, it seems like a simple and affordable vegetable that is often added to salads, sandwiches, and even green smoothies. However, in its raw form, it can be a real challenge for the stomach and intestines. The reason lies in the high concentration of sulfur-containing compounds and enzymes, which begin to actively affect the mucous membranes and gut microbiota within minutes after consumption. According to the Cleveland Clinic, 82% of people with irritable bowel syndrome experience worsened symptoms specifically after eating raw onions. Gas, bloating, heaviness, cramps, and even sharp lower abdominal pain often follow even a small salad. This is especially common among those who consume raw onions every day, believing them to be a natural antiseptic or a digestive cleanser. One such case involved Julia, a 36-year-old woman from Chicago. For several months, she had been eating vegetable salads for breakfast, consistently adding fresh white onions. After just 3 weeks, she began experiencing abdominal pain, which she initially blamed on stress. But one night, the pain became so intense that she was taken to the emergency room with suspected appendicitis. Doctors at Northwestern Memorial Hospital ruled out surgical causes and, after evaluation, diagnosed a flare-up of irritable bowel syndrome. Daily consumption of raw onion was identified as one of the contributing factors. But the intestines are only part of the problem. Raw onions also have a harsh effect on the stomach lining. Their enzymes stimulate the production of hydrochloric acid, especially when onions are eaten on an empty stomach or in large amounts. This can lead to heartburn, irritation, and, with regular exposure, chronic gastritis. Harvard Medical School confirmed in one observational study that 42% of patients with an existing gastritis diagnosis experienced worsening symptoms after consuming raw onions. That was the case with Derek, a 44-year-old man from New York, who switched to a clean-eating lifestyle and started preparing daily vegetable salads with onions. After just 1 month, he began to feel pain under his ribs, heaviness after eating, and sour burping. A gastroscopy performed at Mount Sinai Hospital revealed focal gastritis with increased acid production. After eliminating onions from his diet, his symptoms decreased within 10 days. If you have irritable bowel syndrome, gastritis, ulcers, reflux, or if you simply feel heaviness after meals, you should avoid eating raw onions in salads or appetizers. They can significantly worsen the condition of your mucous membranes. Instead, choose baked, stewed, or lightly sautéed onions. Their irritating properties are greatly reduced after heat treatment. Never eat raw onions on an empty stomach. Pay attention to how your body reacts. Even if you are in good health, regular discomfort after eating raw onions is a good reason to reconsider your diet. Raw onions can irritate the bladder and may lead to frequent urination. According to the National Institute on Aging, 1 out of every 3 people over the age of 50 experiences symptoms of an irritated bladder. These symptoms can include frequent urges to urinate, nighttime urination, burning sensations, or even pain. Such complaints are especially common among women as estrogen levels begin to gradually decrease after the age of 40, making the mucous membranes of the urinary system more vulnerable. Under these conditions, even familiar foods that never caused discomfort before may become problematic. One of them is raw onion. From the perspective of medical nutrition, onions are considered to have a high irritant potential. Their volatile compounds and active enzymes can enter the urine and affect the walls of the bladder, causing increased urgency, a sensation of pressure, incomplete emptying, or even sharp discomfort during urination. This reaction is especially pronounced in people who already have existing issues such as cystitis, overactive bladder, urogenital inflammation, or those going through the postmenopausal stage. A study conducted at the University of California, Davis, and published in the Journal of Urology Research confirmed that in women with heightened bladder sensitivity, consuming foods with high acidity and sharp flavors, including raw onions, garlic, and spicy seasonings, worsened symptoms in more than 46% of cases. Researchers concluded that the irritation of the mucous membrane may be triggered directly or indirectly by changes in the urine's acid-alkaline balance. One real-life case involved Linda, a 52-year-old resident of Columbus, Ohio, who decided to switch to natural eating and for several weeks had vegetable salads with large slices of red onion twice a day. Within just a few days, she noticed increased urges to use the restroom, especially at night. Then came a mild burning sensation and a feeling of heaviness in the lower abdomen. At first, she assumed it was a urinary tract infection, but tests at Ohio Health revealed no bacterial infection. Urologist Dr. Rachel Bennett reviewed Linda's diet and recommended completely removing raw onions. Within 3 days, her symptoms began to subside, and within a week, her normal urination pattern returned. If you notice increased urges to urinate, discomfort during urination, or even mild cramping after eating onions, especially raw ones, eliminate this food from your diet for at least 1 or 2 weeks and observe any changes. Instead of raw onions, use roasted or stewed vegetables with a mild flavor, such as baked carrots, zucchini, or greens without strong essential oils. When it comes to spices, turmeric, basil, or a small amount of dried oregano may be better choices. And most importantly, if you experience any unpleasant symptoms related to the bladder, do not delay visiting a doctor. Sometimes a simple dietary change can relieve you of prolonged and unnecessary discomfort. Raw onions can trigger flare-ups of pancreatitis. Pancreatitis is one of the most painful and difficult to predict conditions affecting the digestive system. According to the National Institute of Diabetes and Digestive and Kidney Diseases, more than 200,000 cases of acute or chronic pancreatitis are diagnosed in the United States each year. What is especially concerning is that flare-ups are increasingly occurring in middle-aged individuals who generally lead a healthy lifestyle. One of the overlooked causes of these flare-ups is something as common as raw onion. The pancreas is an organ that is extremely sensitive to any irritants. Any food that causes a sudden increase in enzyme production can put a tremendous strain on it. A study from the University of Michigan, published in the American Journal of Gastroenterology, found that raw onions contain highly active sulfur compounds, including thiosulfonates and allyl sulfides. These substances are responsible not only for the distinctive taste and smell of onions, but also directly stimulate the enzymatic activity of the pancreas. For people who are already prone to pancreatic inflammation or who have had previous episodes of pancreatitis, this stimulation can result in a severe flare-up. This is especially likely when raw onion is eaten on an empty stomach or in combination with other irritating foods, such as fatty meats, alcohol, or spicy seasonings. One clinical example involves Richard, a 51-year-old resident of Austin, Texas. Since his teenage years, he had paid close attention to his diet, avoided fast food, and followed a clean eating approach. One day, inspired by an article about the benefits of natural antibacterial foods, he began adding thick slices of raw white onion to his turkey sandwiches. After 10 days of these enhanced meals, he experienced sharp pain in his upper abdomen that radiated to his back and worsened after eating. He was taken to Ascension Seton Medical Center, Austin, where doctors diagnosed him with acute pancreatitis. After discussing his eating habits, gastroenterologist Dr. Leslie Rose directly linked the flare-up to his consumption of raw onion. The patient required intravenous nutrition and 2 weeks of strict dietary supervision. If you have ever been diagnosed with pancreatitis, even a mild form, or if you feel heaviness in your left upper abdomen after meals, you should completely remove raw onion from your diet. Even a small amount can trigger a flare-up, especially when combined with fatty or high-protein foods. Instead, opt for baked or stewed onions. Heat treatment breaks down their harsh compounds. Do not eat onions on an empty stomach. And if you notice the first signs of discomfort after eating, such as pain, nausea, or bloating, make sure to see a gastroenterologist. The pancreas does not tolerate experiments. Keeping it healthy requires thoughtful eating habits. Raw onions can raise blood pressure in hypersensitive individuals. According to the American Heart Association, approximately 75 million adult Americans have been diagnosed with high blood pressure. Another 30 million are considered at risk, experiencing occasional spikes in blood pressure, especially during periods of stress or when their diet is disrupted. People with conditions such as neurocirculatory dystonia or autonomic instability are particularly sensitive to changes in blood pressure. In such cases, even familiar foods can trigger unexpected vascular reactions. Onions are traditionally viewed as beneficial for people with hypertension. It is believed that the antioxidants and flavonoids they contain help dilate blood vessels and strengthen arterial walls. However, this benefit applies only to limited amounts of cooked onions. Raw onions, especially sharp white or yellow varieties, behave very differently. Their essential oils, sulfur-containing compounds, and high concentration of volatile substances can cause a reflex vascular spasm, particularly in individuals with a highly sensitive nervous system or unstable blood pressure. A study conducted at Baylor College of Medicine and published in the Journal of Human Hypertension found that patients with labile blood pressure experienced an increase in systolic pressure of 10 to 12 millimeters of mercury within the first hour after consuming meals high in raw onions. This rise was often accompanied by facial flushing, a feeling of heat, and heart palpitations. Such reactions were more commonly observed in women between the ages of 40 and 60, especially during the perimenopausal period. One clinical example involved Amelia, a 45-year-old college instructor from Boston. For several months, she noticed that after lunch at a cafe, where she often ordered a vegetable salad with onions, she experienced dizziness, facial redness, and growing anxiety. At first, she attributed it to stress or coffee, but one day she measured her blood pressure and it was 160 over 100. At Brigham and Women's Hospital, she underwent testing and doctors ruled out endocrine and cardiovascular conditions. Her primary care physician, Dr. Peter Lynch, suspected a food-related trigger. After keeping a food diary, they discovered a pattern. Her blood pressure consistently rose 30 to 40 minutes after eating meals containing raw onions. Once she completely eliminated them, her symptoms disappeared. If you suffer from fluctuations in blood pressure, experience throbbing in your temples, or feel your heart racing after meals, take a close look at what you are eating, especially if raw onions are a regular part of your diet. Women with hormonal imbalances, people with neurocirculatory dystonia, those with chronic anxiety, and individuals with heightened sensitivity to odors are at higher risk. The best course of action is to eliminate raw onions from your diet for 2 weeks and monitor your condition. If your well-being improves, you may have found your personal trigger. For a gentler flavor alternative, consider using baked onions, green onion stalks, fennel, or sweet bell peppers. And most importantly, always consult a doctor about blood pressure spikes rather than masking the problem with medication without proper evaluation. Raw onions can trigger headaches and migraines. Headaches are not just a minor inconvenience. They are a serious issue that affects the quality of life for millions of people every day. According to the American Migraine Foundation, more than 40 million adults in the United States suffer from chronic or episodic migraines. These are not just headaches. Migraines are a complex neurological syndrome that can involve nausea, sensitivity to light and sound, reduced concentration, and even speech disturbances. Although migraines are still not fully understood, doctors have long recognized that each person has their own triggers, factors that provoke an attack. One of the most unexpected but dangerous triggers is raw onion. Many people think of onions as a healthy and essential vegetable, but when an onion is cut, it releases volatile compounds into the air, primarily sulfenic acid, which almost instantly converts to syn-propanethyl S oxide. This compound strongly irritates nerve endings, not only in the mucous membranes of the eyes and nose, but also in the sensitive receptors of the trigeminal nerve, which is closely linked to the brain's pain perception system. These compounds tend to provoke especially intense reactions in people who are predisposed to migraines. A study conducted at Yale University and published in the Journal of Neurological Science in America found that 61% of migraine patients experienced a significant increase in headache intensity within 1 hour of consuming raw onions. The researchers concluded that even brief exposure to biologically active volatile compounds can disrupt the neurochemical balance in brain regions responsible for pain regulation and vascular tone. One real-life medical case involved Elizabeth, a 39-year-old literature professor from Seattle who had been suffering from episodic migraines for 10 years. Her attacks occurred about once a month and lasted between 6 and 24 hours. But over the past 6 months, she noticed that her migraines were becoming more frequent and more severe. Following her neurologist's recommendation at Swedish Medical Center, she began keeping a food diary and discovered a clear pattern. Each episode began 30 to 60 minutes after eating something that contained raw onion, whether it was a restaurant salad or a homemade sandwich. After completely removing raw onions from her diet, her monthly migraine count dropped from 6 to 1, and the intensity of the pain decreased significantly. If you suffer from migraines, tension headaches, or even occasional headaches after meals, pay attention to whether your diet includes raw onions. This applies not just to salads and sandwiches, but also to sauces, side dishes, and dressings. Even a small amount of fresh onion can be an invisible but powerful trigger. The best approach is to eliminate raw onions from your diet for at least 2 weeks and observe how your body responds. If the frequency or severity of your headaches improves, you may have found your trigger. Instead of raw onions, use baked or stewed vegetables, which do not release these active compounds. And remember, if you suffer from migraines, any dietary changes should be made under the supervision of a neurologist. The right nutrition, combined with medication, can greatly reduce the frequency and intensity of attacks. Raw onions can worsen symptoms in people with liver disease. According to the American Liver Foundation, around 30 million people in the United States are currently living with various liver conditions. These include non-alcoholic fatty liver disease, steatosis, hepatitis, fibrosis, and cirrhosis. The number of cases of fatty liver disease in particular is rising rapidly, largely due to poor diet and elevated insulin levels. What is especially concerning is that many patients are unaware that certain familiar foods may overload the liver and speed up the progression of the disease. One of these hidden irritants is raw onion. The liver is an organ that performs over 500 biochemical functions every day. It filters toxins, breaks down fats, processes medications, regulates blood sugar, and plays a key role in protein metabolism. When the liver is weakened or inflamed, it becomes especially sensitive to aggressive substances, including biologically active compounds found in food. Raw onions contain thiosulfonates, allyl sulfides, and other sulfur compounds that stimulate liver activity, trigger enzyme production, and increase blood flow in hepatocytes. This may sound beneficial, but not when the liver is already under strain. A study conducted by Tulane University School of Medicine and published in the American Journal of Clinical Nutrition found that in cases of fatty liver disease, excessive stimulation of liver enzyme activity leads not to cleansing, but to heightened inflammation. This is particularly true for patients who are overweight, insulin resistant, or have chronic inflammatory conditions. For these individuals, even brief stimulation can cause a flare-up, leading to pain in the right upper abdomen, a feeling of heaviness, and nausea after meals. One real-life case involved Daniel, a 59-year-old resident of Denver who was under medical supervision for steatohepatitis, an inflammatory liver condition caused by fat accumulation. He followed his doctor's recommendations, avoided alcohol and fried foods, and stuck to a proper diet. However, hoping to improve his health further, he began adding raw onions to his meals every day, in salads, with meat, even on his morning sandwiches. Within 2 weeks, he began to feel heaviness in his right side, discomfort after eating, and fatigue. A follow-up examination at the University of Colorado Hospital showed elevated liver enzymes, ALT and AST, indicating a flare-up of liver inflammation. Gastroenterologist Dr. Richard Morris explained that the raw onions were the trigger and advised him to eliminate them entirely from his diet. If you have been diagnosed with any liver condition, whether it is steatosis, chronic hepatitis, fibrosis, or cirrhosis, you should completely remove raw onions from your diet. Even a small salad can trigger an inflammatory response. Cooked onions, whether stewed, baked, or boiled, are much less aggressive and may be acceptable in moderation. Avoid spicy and strongly scented foods unless approved by your physician. The liver is a silent organ, but when it is irritated, it responds quickly and painfully. Your diet should be as gentle as possible, focusing on boiled vegetables, lean fish, buckwheat, and plenty of clean water at room temperature, approximately 22 degrees Celsius, which is 71.6 degrees Fahrenheit. And of course, when making any dietary changes with liver disease, it is essential to consult a gastroenterologist. Raw onions increase acidity in the mouth and can damage tooth enamel. According to the American Dental Association, approximately 62% of American adults between the ages of 30 and 60 suffer from heightened tooth sensitivity. This means that when they consume hot, cold, or acidic foods, they experience a sharp, piercing discomfort. Many patients do not realize that one of the causes of this problem is not sugar, as is commonly believed, but something as simple as a salad with raw onions. Raw onions have a distinctly acidic reaction. When combined with vinegar-based dressings or lemon juice, both frequently added to salads, the level of acidity in the mouth increases sharply. This change alters the pH balance in the oral cavity, breaks down the protective film on the surface of the teeth, and gradually thins the enamel, the hardest substance in the human body. Once enamel begins to erode, it cannot regenerate naturally, and even a sip of cold water can become painful. Dentists from the California Academy of Dental Medicine in San Diego conducted an observational study across 5 private clinics, examining how everyday eating habits affect tooth enamel. The report, published in the Journal of Dental Research America, noted that patients who ate meals containing raw onions at least 4 times per week experienced an average enamel loss of 28% in the cervical area of the teeth over the course of a year. This was especially common among individuals who ate tangy salads with vinegar on an empty stomach. A real case from clinical practice involved Sharon, a 47-year-old human resources manager from San Jose. For several months, she regularly brought a homemade salad to work made with cucumbers, tomatoes, vinegar, and thinly sliced red onions. At first, she ignored the mild tingling in her teeth, but over time, she could no longer drink water from the cooler without pain. After visiting a private dental clinic, Dr. Lawrence Kinley performed a diagnostic examination and confirmed enamel erosion on her front teeth. After a detailed review of her diet, the culprit was identified as her daily salad with onions and acidic dressing. Once she eliminated these foods and completed a remineralization treatment, her condition improved. If you enjoy salads with raw onions, especially when combined with vinegar or lemon juice, avoid eating them on an empty stomach and do not consume them every day. After eating such meals, rinse your mouth with clean water at room temperature, about 22 degrees Celsius, which is approximately 71.6 degrees Fahrenheit, to neutralize the acid. Never brush your teeth immediately after consuming acidic foods. Doing so can cause further damage to softened enamel. Wait at least 40 minutes before brushing. Also, include foods rich in calcium and phosphorus in your diet, such as cheese, leafy greens, and almonds. At the first signs of sensitivity, be sure to consult a dentist. The earlier you take action, the better your chances of protecting your teeth from damage. Raw onions can worsen joint problems in people with gout. According to the National Institute of Arthritis and Musculoskeletal and Skin Diseases, about 9 million Americans live with a diagnosis of gout, a metabolic disorder in which uric acid crystals accumulate in the joints. With an aging population and increasing consumption of high-protein foods, the number of diagnosed cases continues to grow. What is especially concerning is that this condition is now being seen not only in men over the age of 60, but also in postmenopausal women. Few people realize that even foods considered healthy, such as raw onions, can be hidden triggers for inflammatory flare-ups. Onions do contain antioxidants and phytoncides, but for individuals with impaired purine metabolism, they can become a real problem. The issue lies in their sulfur-containing compounds and allyl derivatives, which participate in metabolic processes and may increase uric acid production. These compounds can also contribute to an acidic shift in tissues, promoting the crystallization of urates in the joints. The risk becomes even greater with daily consumption of raw onions, especially when combined with protein-rich foods like meat, beans, or eggs. A study conducted at the University of Southern California and published in the American Journal of Rheumatology found that among patients with gout who regularly consumed pungent vegetables high in organic sulfur, including garlic and raw onions, the risk of a flare-up within 1 month increased by 31%. Men over the age of 50 were especially vulnerable, particularly those with recorded spikes in uric acid levels above 440 micromoles per liter. One real-life case involved Thomas, a 62-year-old resident of Tampa, Florida, who had successfully managed his gout for a year through diet and medication to lower uric acid levels. However, hoping to boost his immune system, he began eating salads with large amounts of raw red onions every day. After just 1 week, he experienced a severe inflammation in his big toe with pain, swelling, and difficulty walking. At Tampa General Hospital, tests confirmed that his blood uric acid level had spiked, and the joint inflammation was consistent with a gout flare-up. Rheumatologist Dr. Emily Becker pointed to the likelihood that the excessive intake of onions, especially combined with protein-based meals, was the cause. If you have been diagnosed with gout or even have elevated uric acid levels in your blood, you should avoid eating raw onions every day. Combinations of onions with meat, eggs, or rich dressings are particularly risky. It is better to use stewed or baked onions, since cooking breaks down their active sulfur compounds. Be sure to monitor your uric acid level at least once every 3 months, and whenever you change your diet, keep a food diary. Your meals should favor alkaline foods such as zucchini, cucumbers, buckwheat, watermelon, and herbal teas. And remember, gout is a disease of accumulation, and even small daily excesses can lead to painful and acute flare-ups within a week. Raw onions can be dangerous when taken with certain medications. Modern pharmacology has reached a point where millions of people manage chronic conditions every day with the help of effective medications. According to the National Institute of General Medical Sciences, about 65% of American adults over the age of 45 take at least one prescription drug daily, and nearly 20% take 3 or more. However, very few people consider that even seemingly healthy foods can interact with medications and alter their effects. This is exactly how raw onion works, especially when combined with certain classes of drugs, including blood thinners and calcium channel blockers. Onions contain a high amount of sulfur compounds, particularly allyl sulfides, along with quercetin, a natural flavonoid that can alter liver enzyme activity. These substances can enhance the effects of anticoagulants such as warfarin and slow down their metabolism. As a result, the risk of spontaneous bleeding increases, including bleeding gums, nosebleeds, and in severe cases, internal hemorrhages. The same mechanism applies to calcium channel blockers used to treat high blood pressure. When combined with onions, their vasodilating effects can become unpredictable. A study conducted by the Department of Clinical Pharmacology at Emory University School of Medicine in Atlanta and published in the Journal of Drug-Nutrient Interactions showed that regular consumption of more than 30 grams of raw onions per day among patients taking anticoagulants increased the risk of side effects by nearly 41%. The researchers concluded that foods high in quercetin and sulfur should not be considered neutral in the diets of patients taking medications with a narrow therapeutic range. One clinical example involved George, a 68-year-old retiree from Newark, New Jersey. After undergoing heart surgery, he was prescribed warfarin by his cardiologist to prevent blood clots. Around the same time, he embraced a natural diet and began eating a daily salad made of spinach, tomatoes, and a generous serving of fresh red onions. Within 2 weeks, he noticed his gums bleeding when brushing his teeth and unexplained bruises appearing on his arms and legs. His wife took him to the Robert Wood Johnson University Hospital, where doctors recorded a significant drop in blood clotting ability. His INR was above 4. After reviewing his food diary, it became clear that the daily consumption of raw onion was the cause. Once the onions were removed from his diet and his medication dosage was adjusted, his condition stabilized. If you are taking anticoagulants such as warfarin, dabigatran, or apixaban, calcium channel blockers such as amlodipine, or any medication that affects blood clotting, it is essential to consult your doctor before consuming raw onions regularly. Do not assume that a natural product cannot affect medications. That is a dangerous misconception. Watch for any signs such as bleeding gums, nosebleeds, unexplained bruising, or increased fatigue. These could all be warning signals. Instead of raw onions, opt for stewed or baked onions. Heat treatment partially destroys the active compounds. Most importantly, never adjust your medication dose on your own. Nutrition during medical treatment is just as important as the medication itself. Raw onions, despite their reputation as a healthy food, can have a serious impact on everyday well-being, including sensitive issues like body odor, breath freshness, sweating, and even sleep quality. These effects are not imagined. They are supported by clinical and statistical evidence. According to data from the Skin Disease Institute at the University of Minnesota, about 21% of American adults report experiencing a noticeable increase in body odor that is not related to poor hygiene or physical activity. The cause may lie in diet, and raw onions are among the top suspects in these cases. After eating raw onions, volatile sulfur compounds, particularly allyl sulfides, enter the bloodstream and circulate throughout the body. Some of these compounds are released through breath, but most are excreted through the skin and sweat glands. Unlike the smell of garlic, which typically fades within a few hours, the odor caused by onions can linger for up to 8 hours, especially when sweat glands are highly active. One real-life example involves Logan, a 35-year-old IT employee from Sacramento, who began eating salads with a large amount of raw red onion for lunch, thinking it was a healthy alternative to fast food. Within just a few days, his coworkers started to notice an unpleasant smell coming from him, especially later in the day. Logan practiced good hygiene, used deodorant, and did not smoke. After visiting a private clinic and consulting with dermatologist Dr. Charlotte Jenkins at the Sacramento Dermatology Institute, it was discovered that his sweat glands were actively excreting sulfur-based metabolites from the onions. Once he stopped eating raw onions and switched to cooked vegetables, the odor disappeared in less than a week. But the issue goes beyond odor. Raw onions can also increase sweating, especially in people who are already prone to hyperhidrosis, excessive sweating. Their active compounds stimulate the sympathetic nervous system and enhance thermoregulation. The body reacts as if it is being internally irritated. Another case comes from Terry, a 42-year-old fitness instructor from Dallas, who decided to switch to green smoothies and began adding raw onion to them for an extra boost. The result was unexpected. Within 2 weeks, he started sweating even in cool rooms, and his deodorant stopped working. After seeing endocrinologist Dr. Brian Lee at the Baylor Scott & White Clinic, he was diagnosed with a reactive form of hyperhidrosis. Once he removed onions from his diet, his sweating noticeably decreased within 3 days. A third important aspect is sleep quality. Research from the Sleep Study Center at Ohio State University shows that consuming raw onions at dinner can cause increased gas and abdominal discomfort, especially while lying down. This disrupts the deep sleep phase and leads to frequent awakenings. In a 2021 experiment, volunteers who ate a salad with onions 2 hours before bedtime experienced less restful sleep, with their restorative sleep phase reduced by an average of 22%. One documented case involved Mark, a 50-year-old from Atlanta, who ate a vegetable salad with onions every evening for a month, believing it was a light and healthy dinner. After about a week, he began to suffer from insomnia, frequent awakenings, bloating, and difficulty falling back asleep. At the Emory Sleep Center, a sleep study was conducted, and specialists recommended temporarily eliminating gas-producing foods, including onions. After doing so, his sleep returned to normal and his overall condition improved within 5 days. If fresh breath, neutral body odor, and restful sleep are important to you, avoid eating raw onions, especially in the second half of the day. Instead, opt for cooked onions. When sautéed or baked, most of the volatile sulfur compounds break down, leaving behind a milder flavor and aroma. Also, drink plenty of water, especially after eating strongly scented foods. Do not eat raw onions after 18 o'clock, 6 p.m. if you are sensitive to bloating or have trouble sleeping. And if you are prone to excessive sweating, be especially cautious. Even a small amount of onion in your diet can worsen the problem. Remember, body odor is not just about hygiene, it is also about what you put on your plate. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.